Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about realistic career expectations for brand new medical coders. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, today's episode was inspired by a viewer email that I got. And I didn't respond to this email because I typically don't when it comes to questions specifically about money. So I will say this again. I don't answer questions about money. You can't even tell me how much money that you're making and I'll confirm it. I'm not even going to do that because every place is different. But I will say that when you are starting off as a brand new medical coder, that you may be coming from a background that is previously medical. So it takes time to build up to your salary. And a lot of people want to start at their salary, whatever they made as this former medical worker turned medical coder. They want to start out at that salary. And I will say that that is unrealistic. It is unrealistic to expect that you're going to walk in to a brand new field, because medical coding is not like any of these other medical professions. It is not like nursing. It is not like being a radiology tech or a surgical tech. It is like nothing like that. And some nurses will tell me, well, I know how to code. No. A lot of times what they're referring to is that they're selecting codes from a sheet, like a super bill or something. And that is not what medical coders do. So I want you guys to keep that in mind. Now, yes, medical coders make very good money. However, it takes time to build up to that. Unfortunately, there's a lot of these sleazy schools that will sell the field based on what medical coders do make, or they can make, potentially make. And that's how they draw the people in. Well, then sometimes people want to start at that. And they say, well, I'm a former medical whatever, and I want to start off at this salary. Is that possible? Guys, you have to think about paying your dues in. And that is what this field is. Because if you don't have experience, it is difficult enough to get a job as a medical coder to begin with when you have no experience, unfortunately. Why this is, I don't know. They have been going through this since the beginning of time, where coders need to have experience, but how are you supposed to get experience if no one will hire you? This is why I always appeal to my leaders when in my videos, because it starts with leadership. If leadership is not willing to take a chance on somebody that's brand new, you have the potential to lose out on a lot of really good talent. Whereas somebody could say, well, I have 5 years of experience as a medical coder and they've only done one clinic. That doesn't equate to this person really knows what they're doing. So time in does not equal knowledge. Whereas somebody who's brand new and trained properly. Now, I will say that, okay? Because sometimes with some schools, they just cattle herd people through. I'm from Texas. I'm going to say things animal related. They just kind of push people through and they say, well, they'll figure it out. And unfortunately, that's where employers are like, no, I'm not going to train, when they should already know how to code. But if a brand new medical coder can show and display their intelligence as far as this field goes, they should be given a chance. But that's just my advice. That's just my opinion to these employers out there. So if you're listening, that's what I'm saying. Don't lose out just because, there's this hard and fast rule of, oh, everybody has to have experience. It's ridiculous. That's just my advice anyway. But if you're brand new out there, get into the field. Don't expect to make what you're making now. Okay, if you have a really good salary now, expect to start off less. Okay, now I'm just saying, expect that. Now, again, I don't know every employer in the world, and some may start you at what you were making, right? Or some may start you a little bit higher. I don't know. But I will say, to err on the side of conservative, being conservative, is to expect to make a little bit less, but work your way up. Not everybody will have to stay where they are salary-wise. You may start at a particular salary, and then in a few months they say, okay, well, we'll give you a raise after a few months, or maybe after a year, or after you've gotten some experience in. You can continue to look for other jobs that will pay you more, but be prepared to bring your skills to the table. As far as like, okay, I want to make really good money as a coder who has been in the field for a while. Let me make sure that I know what I'm talking about. So if you have stopped studying, you're in the wrong. You need to start studying again. And even if you haven't found a position in medical coding, you don't know when that position is going to present itself, especially if you are actively applying for jobs. So that is something that you can expect. Sometimes another expectation is don't expect to start in medical coding. A lot of people get caught on that hamster wheel of, I want to be a medical coder because that's what I was trained in. But then they can't get a job as a medical coder because either they can't pass a test, an assessment test, or their resume looks terrible and they're not getting any calls. That has a lot to do with it. I always bring up the resumes because if you are not sending out a good resume, that's part of the reason that you're not getting calls. So if you are interested, check my videos, guys. I have tips for brand new medical coder resumes. And I also do resume rewrites. My rate is in the description box below. I'm a medical coder writing resumes that are geared for medical coding. I can do any resume because I've done a few other professions as well. But it's a way that they are being talked to, and employers will be able to spot that right away. And like I said before, I've seen medical coders who are trying to get into the field desperately, but when I look at their resume, I can see why they haven't gotten any calls, because you're not highlighting your skills that you've learned. And even though you say, well, I don't have experience, doesn't matter, you have training, okay? But not starting off in medical coding and starting off in medical billing or as a medical records, working with that, release of information, utilization review, prior authorizations, any of these are going to get you around the people that you need to be around in order to transfer over to being a medical coder. So that is another option that you can have. Sometimes it's not always going to be what you want. And especially when you're a brand new medical coder, you do have to look for opportunities where you can. But some people are just so steadfast and this is what they want, and they don't want to listen to anybody else. And that's part of the problem. And then they go and they talk on these forums, like on Facebook. Another reason why I hate Facebook. I don't like Facebook, guys. I really don't. Because the people that are in there are either trying to get in and they don't know where to go. Then you have the people that are very vocal that are horrible, and they discourage people from getting in because they couldn't get in. And again, if they were doing their research and knew the reasons why, maybe they wouldn't have those issues. But again, it's entirely up to you where you want to go. But I'm telling you now, one of the expectations you should have as a brand new medical coder is not starting off in medical coding, but rather starting in a related field. And there's a lot of hats that medical coders do wear. So it takes going through the job listings, and I've done those job listing review videos. Again, not a popular video that I've tried to put out to help you guys to understand, because the language, what does code abstract mean? What does that mean? What does it mean when they say prophy? What does it mean when they say inpatient? What does it mean when they say outpatient? You have to know these terms. And so, but looking at the job listings will help you, because at least you'll know what they're looking for. Granted, sometimes they say some really off the wall things like, oh, candidate must know ICD-9. And when that happens, that is a employer that has used a template that is quite old, and they have not updated that template. And a lot of times it's the HR folks that are in there trying to put the job listing together. And so they say, oh, okay, we need a new medical coder. Okay, we're going to get this old job description, and this is what we are putting out into the world. And that's wrong. Okay, there's a lot of missing detail there, and that's just not right. So if you see that the candidate must know ICD-9, don't even worry about it. You know ICD-10, and everybody's in ICD-10 now. So, but that's just an expectation. Don't expect to work at home right away. Now, some places in the U.S., they are 100% back in the facilities, back in the doctor's office. Others are doing a hybrid schedule where they are working part-time at home and then they are working part-time at the facility. You have to be willing to work at a place, and you have to be willing to be around others. That is what this field is, right? It is working around other people. Yes, there are remote opportunities, but a lot of times they are going to want you to have experience. Yes, there are some brand new medical coders who started off remotely because of the pandemic. That was what we had to work with. Now, again, everything is changing. So just be prepared and don't automatically assume that you're going to be able to work remotely because you want to. It's not about what you want, folks. And that I don't know that people just don't like it when they don't get their way. And maybe they have a preconceived notion about what this field is, but it's not about you guys. It is about the provider. It's mostly about the patient. It's about the facility. It's about all of these things. Because if you're not selecting the correct code, what happens? The patient gets overcharged or undercharged. The provider loses money or has too much money coming in and they have to end up paying it back. So you really do have to know what you're doing. And that's just one of those things that you have to expect when you're a brand new medical coder in this career field, is that you're not going to be able to always call the shots and say what you want to do. That comes with time. You know, you will be able to say, okay, I'm not gonna work at a place where they're working from a queue. Okay, that would be somebody like me, right? I have experience. If I wanted to leave my hospital, which I don't, but I'm just saying, I'm just giving myself as an example. I have 14 years of experience, right? And if I was to want to go work someplace else and they said, well, our workload is set up where you're not assigned to a particular clinic, but you're working in a queue and we're going to offer you this job, I would decline it immediately, because working from a queue brings out the ugliness of medical coders, because not everybody is a coder's coder. And I've said this, and I'm going to keep saying it. Not everybody's a coder's coder, unfortunately. And sometimes coders will look out for themselves and they'll try to only do the easy charts and not challenge themselves. Again, it goes back to leadership, because leaders should be actively involved in making sure that coders are educated continuously and that they understand, and so that they can code anything. That's the goal, is to be able to be strong enough to code anything. And if you have people who shy away, who get lazy, and who say, I don't want to do that, again, this is not the field for you if that's what you're going to plan to do. Okay, and I know sometimes it gets hard to always have to think all the time with some of these charts, and some of them get very frustrating. But that's why you have to know, and you have to be familiar with those books and keep continuing to study. You know, that's what the other thing. The other thing that I want to address is people who want to come in and work only part-time. Oh, I only want to do this part-time until I kind of get training and things like that. Okay, not a lot of employers, and I say 99.999%. Okay, there's always that one oddball out there. And I don't know every employer in the world, but there's always going to be those folks that want to start off as I want to do this part-time. The problem with this is, when you're starting this, you need to be full-time. This medical coding demands attention. It demands you to have your full focus on it. And if you don't have the time for it, if this is not something that you are really putting your full effort in, this is probably not for you. Because employers are not going to want to have to train somebody who's only working part-time and only going to get half the work out of them that they need. If they are looking for somebody who's part-time, they're looking for somebody who's had experience, because that person can just kind of swoop in and be like, okay, I already kind of know my way around and I know what to do, so I'm just going to go ahead and pick up and start working and doing whatever. But somebody who's brand new is going to have questions, and you will have questions. Doesn't matter if you've passed your test. It doesn't matter if you've done really well in school. People will tell me that, well, Blue, I did really well in school. And the school kind of gives them a false sense of confidence, because when they get out in the real world, they find that providers don't document like the book. The book is going to give you all of the information that you need, because it is a book. You know, it's not something that it's like, well, you know, no, it's literally a book. So it's going to give you all the information that you need. And with that, you're going to have everything. Nothing's going to have to be queried. With providers, you will get them. They will either have training from somebody who doesn't know, like as far as like other providers, because providers can talk to providers, And sometimes they don't always understand the coding rules. And when they think they know, they tell their peers, and their peers are like, oh, okay, well, I didn't hear this from my coder, so I'm going to start doing it. And it's very difficult when providers go to like conferences and they start talking to each other and, oh yeah, we do this at my facility. And oh yeah, my coder said to do this. But sometimes we need to verify, is this actually correct? We can't just take somebody else's word for it. We can't just take, well, this facility is doing it, so we should be able to do it. No, that's not the way that it works. Everybody has different rules. Different regions sometimes have different rules. Insurance companies, again, have those different rules. So when you're getting in this, know that if you are trying to get in it to work part-time and do something on the side and do it whenever you want to, that's almost impossible, because they're going to want you to have some structure when you're brand new. Now, when you've established yourself, when you know what you're doing and you're doing like contract work, that is something completely different. That is not in the beginning though. Okay, so I just want people to have realistic expectations. And if I'm bursting your bubble and upsetting you, I want you to know the truth. Because people who are trying to sell these things are not going to tell you the truth. I have nothing to sell you. Nothing. So that's just my advice anyway. But yes, so I just want you guys to know that it does get better with time. I mean, you know, coders have a potential to do very well financially. Everybody knows this. And you have the potential to not just do medical coding. You also can branch off into other things like CDI, clinical documentation integrity, or being an auditor, or, you know, doing education, provider education, or medical coder education, you know, training other medical coders, or, you know, any of those things. So there's a lot of different avenues. There's data analysis. And again, it's even more when you get like experience and you really understand. And I always tell people that if you're going to try to get into any of these other specialty things, that you need to have had experience in everything, so that like from the ER to inpatient to outpatient to profi coding, you need to have had all of that experience so that when you speak, you can speak from experience. Because there's nothing worse than an instructor who has never been a medical coder, but they got their degree and maybe they had teaching before and now they're just kind of teaching, you know, from a book and not having that real world experience. You know, that affects the way that that particular instructor can instruct other students. Now, somebody who's had experience would make a better instructor because they have been in the field, they know their craft, and they know how to say, okay, well, the book says this, but this is actually what happens in the real world. So there's a difference there. So getting experience and making sure that you are not limiting yourself to, oh, I only want to do easy things, or I only want to work in risk adjustment, because that's just diagnosis coding. Sometimes you got to be careful with risk adjustment. I will say this, all right, before I close this video out. Be careful with risk adjustment. People get super excited and they get a false sense of confidence with that risk adjustment coding because it's only diagnosis coding. You have to be strong in pathophysiology, yes, because you need to understand the disease process. You really do. You really should, actually. But some employers will not take risk adjustment as experience. And the reason that I say this is because in the job listings that I've seen on Indeed, they will say if your only experience has been in risk adjustment, if your only experience has been in like coding in PT and OT, that's not considered experience to them. So just be careful. And even when you have it on your resume that you've only done risk adjustment coding, they're going to know that you have not done evaluation and management. They're going to know that you have not done procedure coding. And a lot of times they're going to pass because this person can only do diagnosis coding. That's what they're going to see. So if you're in it to get your feet in and to kind of get your bearings and kind of understand what's going on, that's okay. But don't get stuck there, guys. That's my advice. Do not get stuck being a risk adjustment coder. It's not all that it's cracked up to be as far as like, oh, if I get all this time in, you know, I will know how to do all these, you know, diagnosis coding. But again, you don't want to neglect the evaluation and management and the procedure coding. And before you complain about evaluation and management, I don't understand it. It's that a lot of times people will tell other people, I don't like it. So then they're like, okay, well, if that person doesn't like it, then I don't like it. and they don't take the time to learn. So it's a cycle that perpetuates itself. So don't get into that hamster wheel of somebody said that they didn't like evaluation and management. They're scared of it. So now I'm going to be scared of it. No, guys, you have to think for yourselves, and you have to be able to say, hey, I'm going to figure this stuff out. I have mentioned so many times the tools that I recommend, EM University, all the things that I recommend in the description box below. Those links for my Amazon affiliate links, you don't have to click on them. The title is there, okay? And so that way you can learn from those. Going through the CPT manual. Again, I don't know why people have an aversion to looking at the CPT manual in the evaluation and management section. So there's plenty of ways to get practice, guys. I'm just saying. So I'm going to go ahead and wrap this one up. If you are out there and you are a brand new medical coder, best of luck to you. And stick with it, because yes, medical coding will put up a fight, and it's not going to run to you with open arms. It's not going to tell you, welcome. Would it be lovely if it did? Yes, it would be amazing. And I think that we would get so much skill and talent to come to the industry if we did that. But until leaderships around the country changes, that's never going to change. Until people start understanding what these credentials are and their true full value meaning, that's never going to change either. And until people who are getting into this field start doing their own research and stop believing things that they hear, like the most ridiculous one being that the CCS, which is a gold standard of medical coding credentials, because it says that you can code both inpatient and outpatient, that a CCS needs a CPC in order to get a job. Again, ridiculous, because a CPC is just the outpatient side. It is just the outpatient side. And the CCS says that you can code both inpatient and outpatient. Now, why would you need a duplicate credential? Because it's somebody in leadership saying that. And again, it's more money that's going out when you've already mastered inpatient and outpatient coding. So again, that's the thing that I will say. Leaders need to be more aware of what's going on with these credentials and understanding them, not pushing unnecessary credentials on brand new medical coders just to sell a course. I'm just saying. I'm going to wrap this one up. Thank you guys again for joining me. Hit that like button if this video helped. If you liked it, share this video if it helped you, and I will see y'all on the next episode. Bye.